and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of
Very
course.
modest too. What we're going to talk about today, Brad, according to you, is your shoulder pain coming from nerve, joint, or muscle? We got 10 tests. That we
Right. Yeah, we had some viewers ask this question, and it's a great question, and we're going to go through and show you. Why don't you have a seat right here,
Sure.
Bob?
By the way, as I'm moving forward here, Brad, I saw a couple new people out there.
Yep.
If you are new to our channel, please take a second to subscribe. We got the button over here on my left, your right. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
There you go, Bob. Okay, so someone comes into the clinic, Bob. They say they got pain in the shoulder. So as therapists, we're not thinking it's a shoulder problem, it could be a joint problem, it could be a muscle problem, exactly what we've been asked. So how do we go about working this out? I don't know about what you, Bob, but I always go to the neck first,
Right.
and I clear the neck.
Exactly.
And one of the first things I will do is ask them, well, where does it hurt and what makes it worse and what makes it better? And the location, if the person is telling me, well, I got pain in my shoulder, but it kind of radiates down, and sometimes it goes down into my hands and my fingers and it feels cold, sometimes it tingles, it's numb at times, I jot that down. Right there I'm thinking, it's probably a nerve problem, and it's probably...
You're leaning more towards nerve than at that point, by far.
Right, I don't know where that nerve is being irritated.
When it goes that far down, right.
Not 100% sure, but it could be. And it could be from the shoulder, it could be from the neck,
Right.
okay? The next thing I like to do is I'll say sit up nice and tall. Now, if you're at home, you want to do this with yourself or someone else, you can, but you need to be gentle. I'm going to put gentle pressure straight down on the head. Does that hurt, Bob? Does that change anything?
Yeah, that hurt. That brought on some pain right here and sent a little pain down my arm.
So right away, that's a positive sign. I'm thinking, well,
the neck is involved.
We definitely got some neck involvement. I also may bring your teeth together gently, and a gentle distraction I'll pull up like this.
That feels better.
And oftentimes, usually that doesn't hurt, but sometimes people will say, oh, that feels better, it makes my shoulder feel better, and all I did was put some traction on the neck. It's pretty clear that we've got some neck going on. Still may have a shoulder problem, but we still got, we could have both, okay? Now, then the other thing, let's say this is no pain. There's another one Bob likes to do. What do we call that one?
Turn back and you just turn this way and go back like that.
And then put a little pressure,
Yeah. And that's really compressing that side up.
Yep.
And you can do it on the other side too. You can turn, go back, and press down.
I'm not bearing on it, I'm just pressing down gently.
Yeah,
okay.
And if that again creates pain down the arm, again, we're again leaning towards the fact that it probably is a nerve coming from your neck.
Right. Why don't you turn around once, Bob? There's one thing I learned in a McKenzie neck program, all the way, I'm sorry, I'm going to have you turn a little bit here. If someone generally has pain in the shoulder, but most of it's back in this area, I'm thinking it's probably from here, but it may not be. Pain from the shoulder joint usually refers this direction, not this way, but it can. So you can't get these rules. I'm just saying.
But as a majority, I'm leaning more towards neck again if I see it back here.
Right. See how we kind of look at things, and this is from experience from the courses we've been to. It all comes together. You want to turn around, Bob?
It could even be upper thoracic area.
You bet.
too.
Yep.
Yeah.
Things referring in that direction. That's the tricky part about pain.
Yeah.
The source of the pain and where you feel it are two different things in a lot of cases.
Right. And you're going to do range of motion too, Brad?
Yes. I'll always, if all those are negative, I'll say, can you look down as far as you can? Look straight ahead. Bring your right ear to your right shoulder. Bring your left ear to your left shoulder. Okay, sit up nice and tall. Keep your shoulders still. Look over to your right as far as you can, like you're trying to see a car coming behind you when you're driving. And then the other direction. I'm looking for range of motion. Everything looks normal so far. Now do a chin tuck. There you go. And now do that chin tuck. Lean back into your chair and look up at the ceiling. Look behind you. Open your eyes up, Bob. I got to see your eyes. There we go. And if you can do all that, normal range, no pain, all these other things we did were negative, I'm feeling pretty comfortable
that it may not be neck.
Yeah.
And, the thing is, if I go like this and I'm this far, generally what you're going to start seeing is a real lack of motion.
Yep.
And that makes you start thinking, yeah, the neck's involved.
Right. I mean, I've had a number of people, this is not uncommon, I'll say, can you look backwards? Go ahead and start looking back, and they start to feel, and they'll say, I feel pain right here. And it's like, the head goes back, we got pain here. It's a referral pain, likely a referral pain from the neck, because the nerves from the neck go down here and all the way to the fingertips.
Yeah, it definitely means that the neck is involved, and there's sometimes we have both,
right.
neck and shoulder.
Exactly.
But that's a place where we're probably going to start,
Right.
is treating the neck first and see what goes away.
Exactly.
So
now, all 4 of those tests, plus a little bit more, took us about 3 minutes to go through. But in the clinic, Bob and I have been doing this for years. I can whip through that in less than a minute easily. Unless there's a red flag, then I'll stop and look at it a little closer. So everything goes clear in the neck, let's say. We're going to go to the shoulder joint now, okay? One thing I learned from one of the great shoulder people, therapists in the United States, George Davies, a physical therapist. I don't know if he's got his doctorate yet, but he's got so much.
I think he does now.
Yeah, I think he does. He may have his PhD. His mind is way up there in the therapy and in the physical medicine world. If someone has pain right there, and I'll have this a number of times with shoulder patients, pain here, not so much here, and they have problems reaching up and behind them, etc. But they say pain right here. That's oftentimes a referral pain from the shoulder joint. Doesn't have to be.
So no pain here, pain right there.
Right. And there might be some pain there, particularly if they're reaching up overhead or behind you. But a lot of the things, they say it hurts right here. And I'm thinking, that indicates here. Not necessarily, but it indicates here.
I'm glad you told me that, Brad, because again, I just had a patient that had this. So
it's amazing how we keep learning as we grow.
Right.
Older, gray.
Wiser.
Wiser, yeah. Okay, and I'm going to go through these next tests pretty quick, Bob. They're just general impingement tests for the shoulder. One is the near, because you bring the arm near to the ear. That's how I remember it. One hand here, and I'll push up here. If this is positive, by the time I'm getting up to here.
Positive, he means it's painful.
Painful, right. That means there's probably an impingement, some kind of
pinching.
Joint problem.
Yeah, the tendon is pinching as it gets up here.
It's a joint problem.
Which is very common, by the way.
Right.
It's probably one of the more common shoulder issues.
Then the next one, I'll go here, elbow here, and I'll go across. So the elbow is going right to this shoulder. And so again, we're doing some pinching up in here. And if you can push, like I'm not pushing hard, but just a little squeeze, normally it shouldn't hurt. Although on my shoulder it hurts a little bit, and I don't have a shoulder problem.
Sometimes it can be your acromioclavicular joint too on that one.
Right, yeah, there's a number of things, but it's
shoulder.
It's a joint thing,
Yeah.
okay? And then the Hawkins-Kennedy, this is where the arm is here, 90-degree bend here. I always hold the elbow right here, and we just go down like this. And, all of these are going to make the person's eyes open up and say, stop that kind of a thing if it's positive.
It shouldn't hurt a lot. If it's a normal shoulder, it shouldn't hurt much.
Right.
At all.
If you got a healthy shoulder, all of those should feel like a little stretch, but, no big deal. Okay, all of those tests are specific to the joint. Okay, so we talked about the nerve pinching. Oftentimes it's from the neck. It can be from the shoulder. A nerve being pinched as the nerve runs through this area. The joint. And now muscle. How do we know if it's muscle or not? One thing I do, and I don't know if you do this, Bob, I'll simply palpate. I'll start up here, and I'll go into the muscle belly.
Yeah.
I don't get around the joint, the bony parts, but just the muscle belly, and I'll work back here. I'll work in the front. There's a lot of muscle in the anterior part of the shoulder, and I'll kind of get in there, because these muscles, especially on someone as massive as Bob, he's got these big chest muscles and shoulder muscles.
Well, one thing I do, Brad, and I'm sure you do too, is I'll actually check the other side first quite often, because they'll go, yeah, that really hurts. And I'll go, does it hurt over here too? Oh, yeah, it really hurts over there too. Or I'll do one first or the
It's
other.
a really good point.
Yeah.
Check one side and then the other. There's one tendon I do like to check, and that's the long head of the biceps. And to do this, why don't you stand up, Bob? Go like this with your palm up. There you go.
My weird hand.
Yeah,
It doesn't matter,
do this
does it?
one. And I'll just say, hold your hand right there, and I'm putting pressure, making that muscle work, okay? And if that feels fine, why don't you turn sideways? I'll go like this, and I'll have them turn their palm forward, elbow straight, and then I'll slowly bring their hand back, and I'm stretching that tendon at a good stretch. And if that gets a sharp pain up in here, that's a positive sign that it's a muscle or muscle tendon. And it's getting up to the joint. Some of these can overlap each other a little bit. Anything else that you do for a muscle tendon?
I would definitely do check for the rotator cuff.
Oh,
cuff
sure.
tear.
The empty can.
The empty can.
Looking
yeah.
at the
So usually about
supraspinatus.
20 degrees forward. Put the hand down, the thumb down,
Mm-hmm.
bring it out about this far, and you're going to push on it. If it
Right.
just gives way, you probably have a partial or rotator cuff tear.
Right.
And that's the supraspinatus.
Right, and so that's kind of the joint, kind of the muscle. There's a little crossover there as well. But I think overall, I think we did a pretty good job.
That was
didn't
10
we, Bob?
tests, Brad.
Yeah.
I'm patting myself on the back.
Yeah.
And you too.
Nice job, yeah.
Nice
Give me a
job.
little pat.
All right. Thanks for watching.